FXB has done important work globally. Can you summarize some of the highlights of the Global HIV program?
Our main mission in the global program has been to build capacity, provide training and build capacity for the countries to develop, implement, and manage prevention of mother-to-child transmission programs. And so we've worked very closely with with other global organizations and with country ministries of health to do that. I think I would probably say one of a couple of very significant accomplishments. One is working with a huge variety of organizations and stakeholders and people from various ministries of health, and doing that very collaboratively to support program development according to the needs of that specific country. And I think we've been very successful in capacity development, and our record there is really stellar in that the countries where we've had the most involvement have been able to we've been able to transfer most of our responsibility to those governments, because the programs were developed and implemented and capacity was built. And now in most of the countries where we've worked, the ministries of health are managing very well with less support from US-based agencies, including the FXB Center. So, for example, in Guyana, we were responsible for setting up and implementing HIV care and treatment for the country of Guyana, in collaboration with the Ministry of Health, in collaboration with CDC and other organizations. But we really ran that program for about 10 years. But our major goal was to develop the in-country capacity so that we would not have to continue to run the program. We need and they need to be able to do that without significant support from the United States and other countries. And we successfully transitioned that project to the Ministry of Health in Guyana 3 years ago, and they have been keeping a high-quality program up and running and providing HIV care and treatment across the country. Similarly, in Tanzania, we worked in Tanzania for almost 10 years, helping to develop capacity for the PMTCT program there. And in Tanzania, over the last few years, we established an office in Tanzania and hired a local team and did a lot of training and provided a lot of technical support and capacity building to that team. And at the end of our second round of funding, a second round of 5-year funding, we turned over the project to the in-country team that we built and established, and they have subsequently been funded by CDC to continue our work, but with the locally trained and developed staff. So that also is a sign of great success when it comes to really building in-country capacity for these programs.